Whooping cough affects people of all ages, but the Kent County Health Department is warning that it can be more severe and deadly for people with chronic illnesses and babies.
It can be very serious.
The Kent County Health Department is warning parents about the dangers of pertussis.
Especially in babies. Babies don't really cough like other people do. They just stop breathing. It's because they're not able to cough up the phlegm that is involved with pertussis.
Whooping cough is a bacterial respiratory infection that is easily spread through the air.
And with pertussis, it's unique because you can cough for months. You're not always contagious for that whole time, but you can be contagious up to 30 days once you start having symptoms.
The health department says that in 2024, 869 cases of whooping cough were reported statewide. In Kent County, 17 cases were reported, 12 of which involved children, with 2 hospitalizations.
So if we're in a community that's under-vaccinated or a community of school-aged children who are sharing respiratory secretions, it can come in waves of outbreaks.
Coughing is common at this time of year, but the pertussis cough is distinct.
So traditionally, patients who are sick with whooping cough will have a large amount of dry cough, and then they'll take a deep breath in that sounds like a whoop or a gasp.
The health department says the best prevention of whooping cough is getting vaccinated.
While vaccination doesn't necessarily prevent you from getting the illness completely, it does do a really good job at keeping people out of the hospital, and especially children, we want them to stay out of the hospital.
The health department says if you or your child has been in close contact with someone with pertussis, you should see a doctor as soon as possible. In Grand Rapids, Darren Bauer, Fox 17 News.